Ethiopia by Alex Powers. Identify and describe the healthcare system model in your chosen country. Ethiopia's most used healthcare system is the out-of-pocket model. The out-of-pocket model is a healthcare system where individuals pay for their medical expenses directly out of their own pocket without any form of insurance coverage. Ethiopia does have some governmental programs for healthcare. However, a significant portion of healthcare costs still does fall on individuals, particularly in rural areas where access to healthcare facilities may be limited. This model is common in many low-income countries like Ethiopia. The out-of-pocket model affects access to care, often leading to injustices in healthcare outcomes, as only people who can afford healthcare system will receive the necessary services. The out-of-pocket model is often seen in developing countries where healthcare issues coverage is minimum and or non-existent. In countries with the out-of-pocket model, healthcare spending tends to be less predictable and can lead to tragic expenses for families facing serious illnesses. What are the concerns and problems within the healthcare system? Barrier to accessing healthcare services is a big one. This is for usually low-income individuals, and it is when people have to pay for their healthcare services directly from their pocket. It is very possible that the person paying may delay or avoid seeking care due to cost concerns and issues. This is very important and very dangerous because it can lead to more severe healthcare problems down the road for the person if they do not choose to get checkups. Financial hardships is another one. Out-of-pocket payment can also lead to financial hardships, especially for individuals who require costly healthcare services. For many people, the cost of major medical treatments can be insanely expensive. In some cases, a person can be banned or even possibly go into debt or bankruptcy if they do not have the money to pay for this. Inequalities is another one. The out-of-pocket payment could also create inequalities in access to healthcare services. This is because people with higher incomes may be able to afford more healthcare services than those with lower incomes, leading to problems and changes in the health outcomes of the person with lower income. How does your chosen country's public health compare to other countries with that model? 3 points to be made is healthcare access, affordability, and health outcomes. When it came to Ethiopia versus India for healthcare access, they both came similar, with both struggling to access easy accessibility with healthcare. In rural areas, even public healthcare may be inaccessible due to long distances or limited facilities. In most cases, rural areas struggle with geographic and financial access to healthcare. The public healthcare sector in rural areas is often underfunded, leading to overcrowding in public hospitals and long waiting times. However, recently, Ethiopia has created solutions to making healthcare more accessible in rural areas compared to other countries like India, where health insurance remains limited or unavailable. When it comes to affordability, India and Ethiopia are still similar. In Ethiopia, a significant portion of the population relies on out-of-pocket payments, particularly for private healthcare services. While public healthcare is provided at low cost or free in many cases, the lack of full coverage through insurance systems means that families may struggle to afford private services or specialized treatments not covered by public services. In India, the reliance on an out-of-pocket payment is a significant challenge. Even though there has been progress in government-run health programs, a large percent of people still pay directly for health services, leading to insane health expenses for low-income families, which is very tragic. When it comes to health outcomes, Ethiopia and India have both increased significantly over the past 2 decades. Malaria is an acute cerebral illness caused by a parasite known as Plasmodium. The disease is transmitted via the bites of infected mosquitoes. About 75% of land and 60% of the population is exposed to malaria in Ethiopia. Ethiopia is generally considered a low to moderate malaria-transmitted country. Ethiopia has achieved remarkable progress in the fight against malaria during the most recent decade through strong preventative and case management interventions. India represents 3% of the global malaria burden. Despite being the highest malaria burden country of their region, India showed a reduction in reported malaria cases of 49% and deaths of 50.5% compared to with 2017. India has made remarkable progress during the recent years in reducing the malaria incidences. Tuberculosis is an infectious bacterial disease caused by microbacteriums, which most commonly affects the lungs. It is transmitted from person to person via droplets from the throat and lungs of people with active respiratory diseases. Ethiopia is one of the 22 high-burden countries where tuberculosis remains one of its leading causes of deaths. In India, it has the highest burden of tuberculosis, with 2 deaths occurring every 3 minutes from tuberculosis, but these deaths can be prevented. I have a quick trivia question for everybody. When it comes to malaria, Ethiopia versus India, which one is 22nd in malaria and which one is in the top? The correct answer is India is in the top and Ethiopia is 22nd. Did you get it right? What are some cultural differences that healthcare workers need to understand when delivering healthcare to countries' populations? Differences in education, urban versus rural divide, language barriers, religious beliefs, and family roles and decision makings are all important. Differences in education, on the other hand, is very important because Ethiopia's education status compared to our education status is very different because they struggle with getting good education while we have very high profound education. So, healthcare workers need to be considerate when using certain language and certain education that Ethiopians may not understand. Healthcare workers also need to understand the problems with urban versus rural divide. In urban areas, it is very nice and they have more supplies and expenses that are able to be used on healthcare. However, when you come to rural areas like in Ethiopia, their healthcare and their hospitals are very different and not as well profound and well clean, meaning that healthcare workers need to understand that they may need to take different approaches when giving medicine and treatments to certain people in Ethiopia because they may not be as used to doing certain things like they were in the urban areas with their nice, profound, good technology and supplies. Also, language barriers is a huge thing that healthcare workers need to understand when delivering healthcare to these countries like Ethiopia, because Ethiopians do speak a different language, so there may be problems and struggles when trying to communicate certain ways and instructions to help with treatments and healthcare problems with Ethiopians. Religious beliefs is very important for healthcare workers to understand. This is because religion plays a central role in the lives of many Ethiopians. The major religions in Ethiopia are Orthodox Christianity, Islam, and Protestant Christianity, with each having a unique cultural practice and beliefs about health. Ethiopian Orthodox Christians are many Christians who follow religious guidelines that affect practices including fasting and during Lent, when patients may have dietary restrictions that cannot be stopped and may prevent their medical health care treatments. Islamic beliefs are many Muslim Ethiopians who observe halal dietary restrictions and may prefer healthcare practices that align with Islamic teachings. For instance, they may require the healthcare interventions adhere to modesty and gender-based preferences. Some people may also turn to religious or spiritual healers before seeking formal medical care. These healers are often seen as trusted sources of advice, and healthcare workers need to respect these practices even if they do not align with the conventional medical approaches. It is very important for healthcare workers to understand that when it comes to family roles and decision making, it is very uncommon that women are tending to be the decision makers, as it is in Ethiopia where women are. This is very uncommon in many other areas because usually the male figures are the decision makers. This is why healthcare workers must understand these differences and be respectful because all countries and all areas are different. Lastly, what can health workers do to respect the cultural diversity of the country? One thing they could do is improve and enhance communication skills. Since Ethiopia is a multilingual society, healthcare workers should be aware of the primary languages spoken in their specific region. In Ethiopia, they have many languages that are spoken widely, and often people feel more comfortable discussing their health in their native language. One thing they could do is use interpreters. If healthcare workers are not fluent in patients' languages, an interpreter can use facilities and understand and build structures and trust with these people. This is specifically important for conveying medical terms and procedures that might be unfamiliar to Ethiopians. Another thing they could do is speak in a more simple and clear language. Healthcare workers should use clear, non-technical language when explaining medical conditions and treatments. Some medical terms may not exist in the local language, so it is very, very essential to describe conditions and medicines in terms that is easy to understand for Ethiopians. Another additional thing healthcare workers can respect is religious beliefs. In Ethiopia, There are many religions, as shown above, and one thing they could do is also be mindful of fasting practices. As mentioned earlier, fasting is an important part of Ethiopian Orthodox of Christianity, Islam, and other religious traditions. Healthcare workers should respect patients' fasting practices and, if possible, adapt to the timing of medication or treatment to accommodate to these religious practices. Another thing is respect for spiritual healing. Many Ethiopians believe in power of spiritual healers, including priests, imams, and traditional healers. In rural areas, it is uncommon for patients to seek spiritual or traditional healing before turning to modern health medicine. Acknowledging these practices without judgment and ask patients about these traditional treatments might be useful. This information can help healthcare workers provide and avoid drug interactions and better understand patients' beliefs about healing when it comes to spiritual healing. Gender norms and modesty are also very important and healthcare workers must respect. Gender norms and gender roles are critical parts of Ethiopian society, and healthcare workers must be sensitive to the gender dynamics in healthcare settings. Women particularly become the decision makers compared to male figures. When it comes to modesty, cultural concepts of modesty and privacy are important in Ethiopia. This is especially significant in the case of examinations or procedures involving the opposite sex. In many cases, patients may prefer same-gendered healthcare providers to maintain modesty during physical examinations, particularly in all areas of Ethiopia. Creating and building relationships with Ethiopians is very important. Healthcare workers should prioritize creating a trusting relationship with their patients. Building and demonstrating empathy are essential to providing effective care. This means listening carefully, acknowledging the patient's concerns, and involving them in decision-making. If a patient has had a serious illness or chronic condition and had a bad experience or lack of understanding in the past experiences, having and building a relationship with them will help reduce their medical anxiety and help them feel more comfortable when explaining their fears to you. Community involvement. Also, particularly in rural settings, healthcare workers should consider engaging with local community leaders, religious figures, and elders to gain acceptance and trust for medical interventions. Community engagement can help reduce stigma around certain diseases and ensure better acceptance of medical care. Another thing healthcare workers could do to respect Ethiopians is focus on preventative health. In Ethiopia, many health issues are related to preventable conditions such as malaria, tuberculosis, child infections, and nutritional-related disorders. Healthcare workers should focus on health education that is culturally relevant and understandable. Healthcare workers can play a key role in promoting health when it comes to preventative health practices such as vaccinations, hand washing, and hygiene practices, while being mindful of how these messages are framed within customs of local beliefs. The last and most important way healthcare workers can respect Ethiopians, but also respect mainly anybody healthcare workers come in contact with, is maintaining professionalism. Respect for local customs does not mean compromising professionalism standards. Healthcare workers must maintain balance between cultural sensitivity and medical integrity. Always involve patients in decision-making processes, providing them with options and respecting their choices, even if those choices do not align with healthcare workers' personal and professional views, is always important because it is the patient's decision, not the healthcare workers. Be open-minded and avoid cultural stereotypes. Every individual is shaped and unique, and their beliefs about every health and issue may vary within their cultural context, so never judge anybody and always make them feel comfortable to come to you with their problems. Pop quiz. Can you remember the 3 religions that Ethiopia follows? The correct answers are Orthodox Christianity, Islam, and Protestant Christianity. Did you get any of them, one of them, 2 of them, or all 3 of them? Lastly, here are some fun facts about Ethiopia. There are 13 months on the calendar in Ethiopia, compared to us with 12 months. Ethiopia runs on its own time, meaning they don't decide when they wake up and they don't know what time it is. Ethiopia is a nation of festivals. They are very prone to have many festivals and fun events with their cultures. Coffee was discovered in Ethiopia. Ethiopia is one of the world's oldest countries ever. And here are my citations.